From Lagos, the nation's commercial capital, this is the news at 10, live from Channels Television. Reported tonight,
W.H.O.
Hello and welcome. Tonight, Minister of Health confirms that a doctor who secretly treated a diplomat who had contact with the index case Patrick Sawyer has died of Ebola in P.Harcourt. World Health Organization expresses worry that Ebola may infect more than 20,000 people before it's brought under control in West Africa. The President asks the National Identity Card Management Team to ensure that the issuance process of the new ID card is prompt. And Russia is accused of sending troops to eastern Ukraine.
And on Business News tonight, Consumer Rights Advocacy Network of Nigeria criticizes fraudulent marketing by some alcoholic beverage producers, calls for free marketing practice.
On sports news, Portugal's Cristiano Ronaldo wins UEFA Best Player in Europe award.
Anxiety is heightening again as the Minister of Health today confirmed 2 fresh cases of Ebola virus disease in P.Harcourt, River State. One of them, a medical doctor, has died, and his widow is said to be symptomatic and has been quarantined. According to the Health Minister, the doctor, Ike Enemoa, is reported to have secretly treated a diplomat who had contact with the index case Patrick Sawyer. Our correspondent, Lanre Lasisi, reports.
Nigeria's Ebola virus status has risen from 13 reported earlier this week to 15. The Minister of Health, Professor W.H.O, told a news conference in Abuja that 2 new cases have been confirmed in P.Harcourt. According to him, an ECOWAS staff who had primary contact with the Liberian-American, Mr. Patrick Sawyer, evaded surveillance and traveled to the city.
You'll recall that the last time we had this interactive session, we told you the number was 13, so we have moved from 13 to 15. You also have noticed that these additional 2 were not treated in the isolation ward in Lagos. One of them is a primary contact of the index case. This primary contact of Mr. Sawyer's had evaded our surveillance team in the last week of July 2014. And traveled out of Lagos to P.Harcourt.
This ECOWAS staff, who is currently not having symptoms of the virus, is the second recorded case of the disease in the city. He's, however, been placed under strict surveillance in Lagos. Meanwhile, the widow of the doctor that secretly treated him is currently being quarantined after developing symptoms of Ebola.
Because the widow is now symptomatic, she has, since yesterday, been quarantined, pending the outcome of laboratory tests being carried out today on her.
Government has urged the public not to panic while pledging for cooperation with health instructions to help reduce the spread.
What does it take for us to just respect a simple rule? You are under observation because you may have a primary or secondary contact, or even a tertiary contact. Why? What is wrong if you simply, for that period, obey the rule? Because we can only defeat this disease with citizens' cooperation.
So far, 15 cases of Ebola have been recorded, including the index case, Mr. Patrick Sawyer. 14 cases have been managed, with 7 discharged from the hospital, 6 deaths, and 1 current case being treated in Lagos. 6 under surveillance in Enugu, 70 in P.Harcourt, and 141 in Lagos.
And this whole news threw the entire oil-rich city into panic, causing the state governor, Chibuike Amechi, to give reassurances that the situation is being handled. The state government has also decided on a location for an isolation center where symptomatic patients will be treated. Our correspondent Mary Alale Yusuf reports on this and the continued efforts to bring awareness of the disease to people across the states.
Emoha in Rivers State was the place picked to site an isolation center long before the news of the Ebola-related death there was broken to the public. This news did not go down well with the people of the community, who had earlier staged a protest, but were eventually persuaded to accept the decision.
I've accepted the quarantine center to be erected here, and the Commissioner of Health in Rivers State has promised us with immediate effect to rebuild our primary health center, which is very, very important to the community. And that was why, because when this was happening, he didn't follow the due process.
For the Rivers State Governor, Chibuike Amechi, there's no reason to panic, as the state, according to him, is prepared to take charge of the situation.
We have the material and human resources we need to fight and defeat the deadly virus. Officials from the Federal Ministry of Health and other international agencies are already here working with the State Ministry of Health to contain and combat the virus.
Medical laboratory scientists come in contact with samples of all sorts, and this is what prompted the chairman of the association in Osogbo, Osun State, to sound a note of warning and sue for caution among members.
In the prevailing circumstance, health workers have been identified as being at greater risk of contracting the Ebola virus, as they are the ones daily taking care of the patients already affected by the disease.
In this meeting with journalists, the chairman of the Trade Union Congress in Kwara State speaks of the union's efforts to enlighten the public by distributing pamphlets among its members and the general public. He believes that the awareness campaign should be intensified by state and federal governments.
This is what we printed, and we are seeing it as a support to assist at containing the spread of Ebola virus.
The drive to create awareness continues in Jos, the Plateau State capital. This time, the members of the Pharmaceutical Council in the state cautioned journalists.
For now, please, for now, let us stop eating bushmeat. Even though Pechama, let us avoid that for now. Since we are not too sure the dynamism of this disease, once it is contained, we can go back to them. In fact, we are eating areas.
Later, the professor gives his reason for organizing the program.
I can tell you with every authority that people open radios during this time to listen to the statistics of those that were infected and, if possible, ways of changing or curbing it. And this can only be done if journalists are involved. And I believe that we have a very wide outreach from the print, from the electronics. So every direction you are there. So there's every need to look at journalists as the pivotal source of information to the public.
He also believes that everyone should be schooled in basic principles of hygiene, like washing of hands. Now, in the words of the Minister of Health, it's not yet time to throw congratulatory parties, especially in the light of new information of contacts in Rivers State, but a time for heightened vigilance and caution. Mary Alale Yusuf, Channels Television News.
In the meantime, the World Health Organization is worried that the number of deaths recorded in West Africa from the Ebola virus disease may hit 20,000. In a document released today, the WHO says the outbreak of the disease continues to accelerate and expressed worry over the situation. More than 40% of reported cases have occurred within the last 3 weeks, and the WHO has urged global leaders to bring in experts to countries affected by EVD. The 4 affected countries in West Africa are Guinea, Liberia, Sierra Leone, and Nigeria. The President has asked the National Identity Card Management Commission to ensure that the issuance process of the new e-card is done swiftly enough to enable many more Nigerians get them as soon as possible. At the unveiling of the e-card in Abuja, Dr. Goodluck Jonathan urged all public and private institutions to key into the project, as the regime of duplication of biometric databases must now give way to a harmonized identification scheme. Our correspondent Chukwuma Onekwusi reports.
So much happened in this banquet hall today as many well-meaning Nigerians converged for the presidential unveiling and launch of the national EID card by President Goodluck Jonathan. As the special guest, he sat down quietly as all the speakers in turn reeled out what they know about the innovation, the EID card.
Verification scheme.
There have been cards, and there have been cards, and there have been several other cards as proof of identity. But no other card can identify you as a true Nigerian more than this one. Secretary to the government is happy that the National Identity Management Commission has tried to survive despite various challenges.
You have done what many administrations could not do. With a sense of fulfillment, I welcome you to this special day, another landmark on your transformation journey.
Using a PowerPoint, the Director General of the Commission took the audience through the use of the card.
We are moving from a situation where identities are not properly established to a situation where it would now be properly established, and then you can neither deny transactional relationships that you've entered into or take advantage of government programs that you are not entitled to.
There were testimonies from the operators of the system on what the identity card can do for the holders anywhere in the world. Some even described it as a cutting-edge moment that every Nigerian should be proud of.
I want to show you because I have my own and I've tested it. We are going to have one card that will enable us to avoid a TIN number for the taxpayer identification, another card or biometric card for our banking transactions, and we'll be able to merge all of them into this one so that wherever you go, every single transaction will be carried out with it. That's my dream, and it's coming to be.
President Jonathan's speech touched on the need for all government ministries, agencies and parastatals to key into the new ID card immediately.
We should therefore ensure that the issuance process is prompt and swift enough to enable many more Nigerians obtain their own EID cards as soon as possible. It is important to ensure that this ID card issuance process proceeds smoothly and that all MDAs and indeed the private sector can benefit from its design functionalities as soon as possible. The Commission should immediately complement the efforts of the Integrated Personnel and Payroll System, the IPPS, and Pension Department by ensuring that federal civil servants and pensioners are enrolled and issue their cards promptly so that the EID and the secure payment platform can both facilitate speedy and safe payment of salaries and pensions. Proliferation and duplication of efforts is neither cost-effective nor security smart. It's important to remove obstacles that may impede the NIMC from the discharge of its constitutional functions and statutory obligations.
As if to confirm the testimonies, he followed his speech by the unveiling of the card. Used it to carry out some financial transactions via the ATM machine. As well as bought some items. The journey has just begun to cover the over 170 million Nigerians. The Commission hopes that with this launch, many Nigerians will enroll and be identified as true Nigerians. Chukwuma Onekwusi, Channels Television News.
In part 2, after the break, Professor Dora Akunyili goes home. Family members, former heads of states, General Yakubu Gowon, and others pay last respects. That's in a moment. Join us again.